Rita Norton, and this session is on local impacts of climate change. And this session is important for at least 4 reasons. One is that we need to be looking at our underserved communities in terms of social justice and broadening the amount of engagement we have on this topic. We need to look at livable communities for all and making those communities healthy. We again need to look at public opinion and how we increase public support. And we need to recognize and find models for local initiatives and leadership. And I think we'll be able to cover those topics very well with the panelists that we've brought together for you to hear right now. With that, I wanted to also mention that many of the leads are taking leadership on this topic. And I am from the San Jose, Santa Clara region, and we've just begun a working group to understand the topic better in terms of what we could do with our local elected officials and our local governing bodies. And to this point, we have decided to do a survey of elected officials, and we put together 2 questions that follow each other that may be useful, and these are suggestions. And the first question would go like this when you're interviewing your local elected official. What legislation promoting climate change solutions would you support? And then the follow-up question would be, what plans for outreach and voter engagement on educating for adoption of climate change programs would you endorse? So we will be using those questions in interviews with elected officials, and we'd love to share your experiences in doing the same. And with that, I'd like to introduce our first speaker, and that would be Jenny BARD from the American Lung Association.
Thank you, and it's great to see everyone here and staying after lunch especially. I just want to note that my mother was a lifelong League member from Ventura County, and she always told us she had 4 children. I'm the youngest, and that the League kept her sane during those early childhood years. And I now belong to the League in Sonoma County, and I just want to give a shout out to Willard Richards, who I met early on, founder of Sonoma Technology, which is an amazing air quality, air monitoring, air assessment organization in Petaluma. So I wanted to start out with this fact right here, which is kind of not, we don't expect to see this in California for sure, but this was a study that was just done by Yale University in partnership with George Mason University, which has done amazing work on climate change and attitudes about climate change. And they found that 1 in 4 people could actually name one health problem to be related to global warming. Only 1 in 4 could come up with one health impact caused by climate change. And 10% said there were no impacts. We have a lot of work to do. So when we talk about climate change and health, the Lung Association talks about the current crisis that we already have related to air pollution and health impacts. Air pollution and climate health are directly related. And some of the key, I'm sorry, I'm learning with these slides which ones work and which ones don't. But you can just see a brief list there of all of the impacts caused by air pollution. At the top, the most serious, of course, is premature death. And we'll talk a bit more about that. Asthma attacks, heart attacks, strokes, emergency room visits. Children are growing up with diminished lung function, which puts them at higher risk for lung disease later in life. So here's just a quick overview of the air pollution grades that the Lung Association gives every year. This is our State of the Air report from 2014. The red counties are the counties that fail. On the left are the ozone grades. The middle one is we call the daily particle pollution. That's the amount of small particles you're breathing over a 24-hour period. And the left one, or the right one, is for the annual standard, how much you're breathing day in and day out. Despite decades of did significant improvements. California is still a long way from meeting its clean air targets. Too many people are breathing polluted air in California. Now, this is brand new information, and I enlarged the Bay Area numbers, even though it doesn't have the biggest impact compared to other counties. I wanted you to see that the California Air Resources Board has just released the numbers of premature deaths caused by exposure to particle pollution in California annually, and the Bay Area's portion of those deaths is 850 a year, with a value of 6.2 billion, and that's basically lost productivity. In the Bay Area, exposure to PM 2.5, which is the smallest particles, is by far the leading health risk from air pollution. It accounts for more than 90% of premature mortality related to air pollution. Now, the Bay Area has also done an analysis of all the impacts, not just premature death, but from breathing pollution, which could be anywhere from asthma attacks to exacerbations of lung disease. And that value that they have looked at, if we reduced pollution in the Bay Area, there would be a benefit of $13.5 billion. Okay, this is a graphic of climate change and public health. The center, the sun, the heat, the climate change. As the rings go around, we are looking at everything from ozone at the top to asthma and allergies going around the circle clockwise, particulate pollution, heat waves, wildfires, hospitalizations and premature deaths, and of course vulnerable populations, which you're going to hear about next. Climate change impacts are being felt now. This winter in the San Joaquin Valley, we saw literally hazardous levels of air pollution caused by stagnant, dry weather. The Bay Area this year, as you know, had unprecedented 20 spare the air alerts. Again, drought conditions were trapping the pollution close to the ground. A newer disease related to drought is valley fever in the Central Valley. Due to drought conditions and dust, the spores are becoming airborne. You may have read that the skin tests conducted by California prison officials this month showed thousands of inmates have been exposed to valley fever. And just from the heat, another Bay Area statistic, according to Dan Kahan, Director of Climate Research at the Division of Scripps Institution of Oceanography, annual average temperatures in the Bay Area are expected to increase between 3.5 and 11 degrees Fahrenheit by 2050. Depending on location, obviously inland uses are going to have higher impacts. And what they have found is that the Bay Area may be particularly vulnerable because the population is not well adjusted to the higher temperatures and existing infrastructure not well suited for adaptation. Thank you. So this, obviously, ozone is a huge climate contributor as well as a pollutant with widespread impacts on human health. With increased heat, we see increased ozone formation. And these are slides showing Riverside on the left and Fresno on the right. Just know the bottom line goes up in heat, and the top line and the one going up goes higher in ozone levels. This is fine particulate matter, and there's so much I can say about this, but the main thing is looking at the, as I said earlier, fine particle pollution is the single largest health risk for air pollution in the Bay Area. And the opportunities for reducing fine particulate matter are huge and will have multiple co-benefits. Diesel is a primary, so diesel pollution, which is a fine particulate matter source, is also the primary source of black carbon, which you've heard about being now, we know, the second largest contributor to global warming behind carbon dioxide. Black carbon has a lifespan of only about 2 weeks. It also has, as you just heard, the hugest health impacts. So there is a lot of recognition that if we can dramatically reduce our black carbon and our particle pollution, we're going to have immediate health benefits, immediate health climate benefits, and reduce a lot of the harm caused by this very serious pollutant. You're going to hear more about vulnerable communities. I'll just skip right over that. But that is one of the most important things to know from the standpoint of exposures of air pollution. Our vulnerable communities, our children, the elderly, those with lung and heart disease, the poor, who are most likely to live nearest the largest source of pollutants, are the most impacted. You heard about AB 32. We consider that California's premier public health law. And I only have 2 minutes, so I'll move on. All the major health, this is a study that we did showing the benefits of our clean fuel policies in California and billions in health cost savings. These are major statements by health organizations on the urgent need to address climate change now. We have the American Academy of Pediatrics, American Nurses Association, and the California Medical Association. As you heard earlier, we also face huge opposition from moving forward with a cleaner, healthier energy future. 70 million is now the total that the California oil industry is spending in California to roll back our clean air laws and our cleaner future. They're targeting legislators, so as you heard, it's very important to get out and speak with them about the health benefits of our climate laws. Here is a cartoon about the front groups protesting the hidden gas tax. So we urge you to continue supporting California's clean air leadership, and these are just some of the many health organizations. Really, all of the major medical and health organizations in California are on board. That is the work that I do with the American Lung Association, is organize the health voices. They obviously have the most credibility when talking about health and climate. And I am done now. I'll just leave you with our little Doctors for Climate Health. And there is some social media for you to write down. Thank you so much.